We will now continue with agenda item 5H, progress reports. This year we have a large amount of progress reports and some have been already taken up during our previous discussions, so we will not come back to them now. I propose that we take these progress reports forward through 5 separate discussions without any introduction of the papers. First, on the reports linked to category 1 and 5, the relevant document can be found in EUR/RC68/8A on tuberculosis and EUR/RC68/8I on AMR. Second, we continue with category 2, reviewing 3 documents, namely EUR/RC68/8B, C, D, respectively, on physical activity, tobacco control, and NCDs. Thirdly, we move to category 3, reviewing document, EUR/RC68/8E on child and adolescent health, EUR/RC68/8F on refugees and migrant health, EUR/RC68/8G on environment and health process. Then we will discuss the item that will be on document EUR/RC68/8H on the action plan to strengthen the use of evidence, information, and research in policymaking. And finally, we will discuss the progress report on accountability and compliance. The other progress reports have been taken forward already during earlier discussion held this week. If this is agreed with you, we will start with the first debate on the reports related to Tuberculosis Action Plan for the WHO European Region 2016-2020 and implementation of the European Strategic Action Plan on antibiotic resistance. The reports are in EUR/RC68/8A and I. The reports will not be separately introduced, so I will therefore open the floor immediately. Delegates wishing to take the floor should raise their nameplates, please. We start with United Kingdom, please.
Thank you, Mr. Chair, and I'll speak on both aspects. The UK supports this report and its description of TB in Europe since 2016 and the progress that has been made to implement the TB Action Plan for Euro. The UK would like to highlight the issue of MDR TB. In 2015, an estimated 200,000 people died of MDR TB, a massive 1/3 of all global deaths from AMR. In 2016, there were an estimated 600,000 new TB cases with resistance to rifamycin, the most effective first-line drug, and 490,000 had multi-drug resistance. The UK recognises drug-resistant tuberculosis as an important threat alongside other drug-resistant pathogens as identified by WHO's priority pathogen list. The UK government is providing £30 million of funding for the Global Alliance for TB Drug Development. We have committed another £30 million for the Foundation for Innovative New Diagnostics, which has already delivered 5 new TB diagnostics, including GenExpert for rapid detection of NDR TB. We have provided £10 million to Arias TB Vaccine Foundation and funding UnitAid, which is tackling access and prices for MDR TB, and the WHO's research on TB implementation. We are pleased that the UN high-level meeting on TB is to be held in New York next week and look forward to fruitful discussions and strong commitment to tackling these important issues coming out of that meeting. And then on AMR, we welcome the progress report on AMR and the efforts being made by WHO European Office on this key challenge. In addition to this useful progress update on key activities, and alongside the outputs listed in this report, the UK would also appreciate seeing an analysis of the outcomes of the European region's activity. We request this information is set out in a follow-up paper. This should also include next steps for the region's AMR activities and details of how the region plans to coordinate its efforts with the European Commission to avoid any duplication. Thank you.
Thank you, United Kingdom. Germany, please, followed by Netherlands.
Danke, Herr Vorsitzender.
Yes, thank you very much, President. First of all, I would like to talk about TB, and then I will move on to AMR. We would like to thank the WHO European region. We'd like to thank you for the preventive measures that have been undertaken to tackle TB in the region. In some countries, major success has already been achieved. The growing rate of TB, HIV co-infection and the resistance situation in the region is a major concern. This year, Germany has allocated €8 million to tackle HIV and TB, and in the next few years we will continue to commit along these lines. At the upcoming meeting, high-level meeting on TB, we call upon all states to show commitment in order to eliminate TB once and for all. In particular, multi-resistant TB is a concern for us all and a major financial burden for many health systems. Therefore, we need to implement the accountability framework and link it with the other SDGs. Moreover, we must also ensure that more TB patients complete their treatment. We also need to tackle stigmatization. We need to ensure that all concerned persons have better access to treatment and diagnosis, and we need to have a patient-focused approach. In parallel, we should also ensure that R&D is continued. We would like to thank the WHO Euro Office for the various steps that have been taken to tackle AMR. This is particularly true for supporting member states when it comes to developing national health plans, and also when it comes to strengthening the AMR antibiotic network. Surveillance is something that we feel strongly about in particular. However, further efforts are needed in order to prevent AMR. The stewardship programme must be combined with campaigns that draw attention to how to appropriately use antibiotics. We must strengthen our efforts along these lines. From a German point of view, it is also vital to implement the Global Action Plan at a WHO Euro level along the lines of One Health. It is vital that we have collaboration between the WHO and the FAO. This year, Germany allocated €2.2 million to implement the AMR plan, and with this we will continue to make such support along these lines. Tackling AMR is an important priority for Germany. Germany has looked at this topic very intensively during its G7 presidency, and also we are going to be looking at it within the G20 as well. Thank you very much.
Thank you, Germany. Netherlands, please, followed by Ukraine.
Yeah, thank you, Chair. The Netherlands are pleased to have a progress report in place. At the same time, the Netherlands feels that results, as presented in the report, should be better used for monitoring progress. The Netherlands appreciates the transparency and clarity of the report, specifically showing how the data are being used. At the same time, reading the report, the Netherlands is very much concerned about the low availability of immunization programs in some countries in our Euro region, and this is to us very worrying. Also, the Netherlands is interested in the tangible progress that will be made to follow up on this report. Thank you.
Thank you, Netherlands. Ukraine, please.
Thank you, Chairman. Today's meeting has happened in the critical period of the fight against tuberculosis, at a time when, along with the presence of new diagnostics and treatment of TB, it continues to kill more people each year than any other infection disease, and ranks ninth among the causes of death in the world. Unfortunately, in 2014, Ukraine entered the top 5 countries with the highest rates of MDR-TB, and the treatment outcomes of sensitive tuberculosis in Ukraine present the second lowest result in the European region, while the treatment outcomes of MDR-TB is also one of the lowest in the Europe. We do not hide these problems, we voice them and decide. However, it is clear to us that an effective response to the current challenges of the TB epidemic requires both the development of more effective treatment regimens, diagnostic tests, and vaccines, and increased access to these services by maximizing the cost reduction for them. We applaud the WHO effort to fight TB and ask to not stop in collaboration with the member state and other organizations. We believe that the outcomes of the high-level meeting in New York will be the approval by the heads of the states of a large-scale political declaration that will boost investment in this area, will lead to new and cheaper existing medicine, and as a result will save millions of lives. Thank you.
Thank you, Ukraine. As I see no one else, we have the request of the European Medical Students Association. Please, you have the floor.
Honorable Chair, distinguished delegates. Antimicrobial resistance is one of the most important modern healthcare challenges affecting our community, the healthcare sector, and our environment. Addressing all relevant factors of AMR requires multidisciplinary and global involvement across all sectors of governance and organization. The European Medical Students Association, EMSA, appreciates the efforts of the World Health Organization in fighting AMR and congratulates the WHO Regional Office for Europe, its member states and partners on the progress achieved regarding the implementation of the European Strategic Plan. EMSA represents over 100,000 medical students from 110 faculties in 28 countries. EMSA is a stakeholder in the European Union's joint action on antimicrobial resistance and hospital-associated infections, and takes an active role in raising awareness and peer education about AMR through local, national, and European projects. The report of the regional office shows that AMR in education has been addressed. However, we want to point out that the scale of AMR, the One Health approach, and the importance of interprofessional collaboration is still not systematically involved in healthcare students' curriculum. European medical students urge governments and institutions to change this in order to equip the next generation of health workforce with the necessary knowledge to contain AMR in clinical practice, to advocate and take action on behalf of their profession and their patients. EMSA is ready to cooperate with WHO to strengthen the collaboration between future healthcare professionals and relevant stakeholders in joint efforts fighting AMR. As a medical students association, EMSA wants to highlight the importance of meaningful youth involvement in this process. Having innovative ideas and the capability to bridge the gap between strategy and practice, we strive to be engaged in all levels of society to improve the health and well-being of the population of the European region. Thank you for your attention.
Thank you. Dr. Emiroglu, you may wish to respond to some of the comments and questions, please.
Thank you very much, President, and I thank the member states who are taking the floor to recognize the importance of two priority public health burden within the region, TB and AMR, and we're grateful to many countries, including Germany, to carrying that to the highest political level with the G7, G20, but also to the UN high-level meeting. And thanks to both also UK and Germany for providing WHO the additional funding to be able to move forward these two globally important agenda items. And I can only fully agree that the research and development, particularly in TB, is a huge need in terms of innovative diagnostics and treatment, which is a pity actually for a disease so old, still not being able to use. Hopefully the UN high-level meeting is going to create that platform to be able to get more interest, more resources into also research and development, as well as the implementation of accountability framework, as you mentioned, is critical for us. We take the request of UK on providing a detailed analysis on the outcomes of implementation of the European Action Plan. It's an excellent idea. Probably we will suggest that under the Standing Committee for the Regional Committee guidance, and we could present them a follow-up paper and then get their guidance on how to share that with the rest of the member states. We have the first meeting in December. And I just want to assure you that we work very closely with the European Commission and as well as the European CDC on implementation of both the European Commission action as well as the WHO action plan. There's a lot of commonalities and we have very close links, as well as we have full engagement within the One Health approach with the FAO and OIE, and we're going to have a regional meeting soon in Kazakhstan to be able to bring those One Health major agencies together. And finally, my comment to civil society, we really welcome your engagement. We need your support. And particularly, we are working with you and welcoming you to raise the awareness, and particularly through the European Antibiotic Awareness as well as World Antibiotic Awareness Week. Thank you very much.
Thank you, Dr. Emiroglu. Now we will consider the following progress reports. Physical Activity Strategy for the WHO European Region 2016-2025. Roadmap of actions to strengthen the implementation of the WHO Framework Convention on Tobacco Control in the European Region. Action Plan for the Prevention and Control of Non-Communicable Diseases in the WHO European Region. The reports are in EUR/RC68/8B, C, and D. Delegates wishing to take the floor, please raise your nameplates. Germany, followed by Netherlands.
Vielen Dank, Herr Vorsitzender.
Thank you, Chairman. I would like to say something about physical activity. Germany is very pleased that WHO wishes to promote physical activity. It's an important topic on regional and international level as well. We would very much welcome more information about systematic activities within the WHO member states during the report period. Especially Action Field 4 is very important because it has to do with older people. Aging persons and persons who need care need to be focused on more in this field as well. Thank you.
Netherlands, please, followed by Russian Federation.
Yeah, thank you, Chair. The Netherlands are pleased to have the progress report on the implementation of the WHO FCTC in the European region. The support of tobacco control in society has largely increased in the Netherlands, and we see a big smoke-free generation movement. Currently, we're working on a national prevention agreement in the Netherlands. And we do this together with patient organizations, healthcare providers, healthcare insurers, municipalities, sports clubs, and social organizations. The Netherlands aim to make firm measurements and agreements that are effective to reduce the smoking prevalence considerably in the coming few years. As mentioned in the progress report, Article 5.3 remains an important element in protecting tobacco control policies. In the Netherlands, there is a widely held sense of concern about the participation of the tobacco industry in the national and international ISO communities. These communities establish the ISO method and the limits for TNCO, which are regulated in the European Tobacco Products Directive. In June this year, the Netherlands National Institute for Public Health and the Environment presented alarming research on this ISO method. It is quite worrying that the measurements taken by using the ISO method do not provide an accurate picture of the amount of TNCO that smokers actually inhale. This is mainly caused by the ventilation holes in the cigarettes, by the general public also called cheating cigarettes. We call on you to take this matter seriously and taking action in the light of this concern. Thank you.
Thank you, Netherlands. Russian Federation, please, followed by Austria.
Thank you very much, President. The Russian Federation supports the report on the implementation of the physical activity strategy for the European region of the WHO 2016-2025. We note the efforts of the European Regional Office and also the GDO on NCDs in Moscow when it comes to reducing by 10% the levels of insufficient physical activity by 2025. Moreover, I should like to underscore that the European countries that are not part of the network of coordinators on physical activity in the European Union have also made their contribution to strengthening the potential of measures to promote physical activity at a national and at a European level. We regret the fact that these achievements have not been reflected in this report. The Russian Federation provides financial support to the priority areas of the WHO on NCDs, including the physical activity strategy at a global and a regional level. Russia guarantees scientific and practical components of the cooperation of the coordinating centres of the WHO that are operating in Russia when it comes to NCDs. On their platform, international study courses have been carried out for the prevention of NCDs, including on physical activity and nutrition. I should also like to note that as part of the implementation of Priority Area 5, supporting action through monitoring, surveillance, the provision of tools, enabling platforms, evaluation and research, with the participation of experts from the Russian Federation and with the leading role played by the GDO in Moscow, 9 surveys have been carried out into the risk factors for developing NCDs on the basis of the WHO STEPS method. Now, as for interagency cooperation, I should like to note the cooperation of the GDO in Moscow, the country office of the WHO in Russia, and the Ministry of Health of the Russian Federation and FIFA in preparing and carrying out measures to promote a healthy lifestyle and increasing physical activity at a global level as part of the World Cup in 2018. In particular, when it comes to in particular through effective work through the media, we appreciate the need for concerted action to solve the issue of low levels of physical activity at a global level, and therefore Russia supports the initiative to draw up a global plan of action in the field of physical activity 2018-2030. We are ready to provide technical and methodological support in drawing up this document. Thank you very much.
Thank you. Russian Federation. Austria, please.
Thank you, President. We welcome the progress report about the strategy of the WHO Euro region for the promotion of health and the promotion of physical activity, the fight against NCDs, and so forth. We also believe that the statistics which have come out recently with respect to physical activity and the older population show that we need to do more in Austria, and therefore in our instruments we certainly refer to the 5 areas pointed out by the WHO, the National Physical Activity Plan and the national goal of having more physical movement in everyday life, and the promotion of sports and physical activity in schools and education. In 2018, we would also like to point to our cycling and tourism plan and also the master plan of our ministry with respect to traffic and technology. And we believe that it will be important to use all these instruments in order to be able to forecast the effects on public health better in future. It's also important to mention that the strategy of 2017 in this respect was a first step forward in the field of prevention of NCDs, among other things. As our experience has shown, we need to pool the forces of various ministries in order to make sure that we can meet these goals. And it's a great challenge for all of us. And therefore, Austria would like to ask the regional office for more support and more instruments to be put at our disposal in order to be able to coordinate better and develop better coordination mechanisms. We would also like to suggest that challenges and opportunities in the field of digitalization, for example, be used as soon as possible in order to improve the situation with respect to physical activity. Thank you.
Thank you, Austria. As I see no other member state wishing to take the floor, I will give the floor to non-state actors wishing to speak and start with International Alliance of Patients Organization. Please.
Thank you, Honorable Chair. Respected Madam Regional Director, distinguished delegates, non-state actors and observers. The International Alliance of Patients Organizations, IAPO, is a non-state actor in official relationship with the WHO and an international alliance with more than 260 patient organization members in over 70 countries. We thank the Secretariat for having prepared the progress report on the implementation of the Action Plan for the Prevention and Control of Non-Communicable Diseases in the European region for the 2016-2025 that has been laid here in front of the WHO Regional Committee for Europe for consideration today. We congratulate the WHO European region member states for the progress made towards addressing non-communicable diseases in the region. IAPO urges member states to accelerate progress towards safe, quality and accessible NCD promotive, preventive, curative, rehabilitative and palliative care services as part of their Universal Health Coverage 2030 obligations. We call upon member states to ensure primary and secondary prevention of NCDs remain a core goal of the action plan through ensuring sustainable and adequate financing to prevent and control NCDs. To ensure implementation of evidence-based programs in early screening and diagnosis of the NCDs in the region. To ensure to commit to the Tokyo Declaration on Patient Safety and to build capacity in the leadership and the health workforce within NCD programs to support safe, patient-centered healthcare, and to bring patient experts, patient groups, and caregivers to the core of the NCD policymaking. Their contribution is significant towards improving the impact and reducing of the NCD healthcare costs. The role of carers in NCDs must be recognized and strengthened. Their health and well-being, including compensation, must be reappraised in the region. We urge the member states to take note of this report ahead of the third UN high-level panel meeting on NCDs to be taking place in New York on the 27th of September this year. Thank you for your attention.
Thank you. the International Pharmaceutical Students Federation, please.
Honorable Chair, distinguished delegates, it's a great honor to speak on behalf of the International Pharmaceutical Students Federation, representing over 350,000 pharmaceutical students and recent graduates in 90 countries worldwide. We congratulate the WHO European Regional Office on the progress made in implementing the Action Plan for Prevention and Control of Non-Communicable Disease in the WHO European region for 2016-2025, and for actively supporting Member States in developing NCD policies and action plans. We would also like to congratulate Member States for the number of policy interventions we have witnessed during these past years, namely the fiscal and marketing policies for tobacco control, alcohol, and food. Nonetheless, much more progress is needed in regard to sin taxes to comprehensively address behavioral NCD risk factors across the region. With an increasing aging population and a growing number of NCD cases diagnosed each year, it is in the economic and social interest of Member States to pursue policies that help reduce the current and future burden of NCDs in society. This translates into strengthening the capacity of health systems and ensuring their sustainability while addressing individual needs. Considering the health expenditures related to NCDs, efforts made in disease prevention, early diagnosis, and effective treatment put us one step closer to addressing health inefficiencies and promoting the sustainability of our health system. The networks of community pharmacies in the European region are the biggest frontline of national health systems. Pharmacists are one of the most trusted and accessible healthcare professionals. With a strong presence at community level, pharmacists contribute to reduce inequalities in access and quality healthcare. For example, reducing the distance to the closest primary healthcare institution, as well as lessening the pressure on primary and emergency healthcare service across the European region. IPSF calls for integrated NCD plans and policies that include community pharmacies as key players in national health systems for better NCD outcomes. From individual patient screening to behavior change, improved therapeutical adherence, community education, public health interventions and awareness campaigns, community pharmacies and pharmacists could undoubtedly respond to many of the biggest health challenges and alleviate the burden of NCDs while contributing to the well-being of our communities and the sustainability of our health systems. Thank you for your attention.
Thank you. World Federation of Societies of Anesthesiologists, please.
Honorable Chair, distinguished delegates, the World Federation of Societies of Anesthesiologists commends the work of the Regional Committee in addressing the global non-communicable diseases crisis and welcomes the action plan for the prevention and control of NCDs in the WHO European Region Resolution 11. The WFSA represents hundreds of thousands of anesthesiologists in 150 countries. We work with our member societies to achieve universal access to safe anesthesia, directly contributing to SDG 3 and UHC. We unequivocally support WHA Resolution 68.15, strengthening emergency and essential surgical care and anesthesia as a component of UHC, and we were proud to be one of 5 non-state actors in the official liaison with the WHO, highlighted in the 2017 progress report. As a significant number of NCDs are not preventable, WFSA is concerned that the action plan places a large emphasis on prevention, which alone will not solve this issue, overlooking the need for detection and treatment, which may in turn require anesthesia, surgery, perioperative and palliative care. Diagnosis, treatment and management represent a critical strategy for successfully addressing NCDs. Virtually all NCDs will require surgical intervention over the life course. Thus, health systems must be able to provide safe, affordable anesthesia, surgery, perioperative and palliative care in order to achieve UHC. The provision of anesthesia and surgical care has long been neglected, and it is estimated that each year more than 4 times as many people die from surgically treatable conditions than from HIV, TB, and malaria combined. Prevention is paramount, but can only be a part of any strategy to combat NCDs. We call on the Regional Committee for Europe to continue to raise the priority accorded to the appropriate diagnosis, treatment, and management of NCDs within global, regional, and national policies. With the global epidemic of premature deaths from NCDs set to rise, it is essential that we have a comprehensive approach at this critical and defining moment. This statement has also been supported by the International Association for Hospice and Palliative Care. Thank you.
Thank you. I announce that we have 2 written statements from Thalassemia International Federation and a joint statement from World Stroke Organization, European Stroke Organization, World Federation of Neurology, European Academy of Neurology. Dr. Mikkelsen, you have response and comments, please.
Thank you, Mr. President, and thank you to the Member States for a rich feedback on the progress reports. First of all, thank you for sharing the best practices in several of the areas. I think this is very encouraging, and we will find ways to showcase and use these examples for inspiration and also to learn from them. I will also make the opportunity to thank you to the whole region, actually sending your heads of states and government to the UN high-level meeting, and especially to the meeting of NCD. Actually, we have 4 heads of states that have asked for the floor in the plenary and 24 ministers. So our region constitutes of a majority of the speaking slots in the high-level meeting. And in addition, we have also either organized or co-organized all the 7 DG prioritized side events during the meeting. So this gives us a very good opportunity to inspire and also to spread our results to the global level. Then coming back to the more specific comments, we take note that there is a need to do more systematic surveys on physical activity, and we are very happy to learn that several of the member states focus on aging. This gives us a very good opportunity to use the way the region really focused through the Health 2020 with integration, and I hope that we will see even more of NCD through the life course in the coming years, also building on the excellent work from the health system to respond to NCD, which is also an answer to the civil society. Through that work and through the assessment and building on the work we have done so far, we will of course continue to focus on management and the whole chain, including also palliative care. We are well aware of the new challenges on tobacco, and it is timely to point out the new very worrying cheating cigarettes, and there is a need to come together and see how we can tackle this. And we also share your view that this is yet again a new attempt from the tobacco industry to hamper the very, very needed work on fighting tobacco. And I'm also very pleased to hear that several of the member states really emphasize the use of FCTC and the progress needed. As you know very well, we are not achieving the targets on tobacco. And we just had a pre-COP meeting, kindly hosted by Portugal, really trying to address what could we do now to strengthen really the implementation, and more works need to be done. Then thank you, Russia, and we appreciate the great work that has been possible through your very generous funding of the GDO in Moscow. And if we are not reflecting all the work in this report, I think we will also see some of this in the progress report from the GDOs. I think several of you have underscored what we see as the new challenge more and more, and that is really to work multi-sectoral and also include ministers from other areas of health. And then coming back to the outcome declaration negotiated in New York, one of the main new achievements there is that there is a clear understanding that it's really heads of state that is needed to tackle the challenges in NCD. And we will continue to build on the intersectoral work that has been already ongoing in this region for several years. And I think, as the RD mentioned earlier today as well, we can actually accelerate and also evolve this further in the coming years. So thank you for your comments.
Thank you, Dr. Mikkelsen. The next group of progress reports for consideration are Investing in Children, the European Child and Adolescent Health Strategy and the European Child Maltreatment Prevention Action Plan, 2015-2020, Strategy and Action Plan for Refugee and Migrant Health in WHO European Region, Implementation of the European Environment and Health Process. The reports are in EUR/RC68/8 E, F, and G. Delegates wishing to take the floor should raise their nameplates, please. We start with United Kingdom, followed by Slovakia.
Thank you, Mr. Chair. I'll speak on child maltreatment prevention. The UK fully supports this important plan and recognises the vital role of the health sector in tackling maltreatment, abuse and neglect. Cruelty to children and young people has serious negative consequences that can persist into adulthood. Adult survivors of childhood abuse are more likely to misuse substances and to experience mental health problems and physical ill health. This is why our Department of Health and Social Care asked the National Institute of Health and Care Excellence, our quality and evidence setting body, to develop 2 guidelines for professionals who work with children and young people. The first, child maltreatment, when to suspect maltreatment in under 18s, was published in 2009 and updated in 2017. It covers the signs of possible child maltreatment in children young people aged under 18 years. It aims to raise awareness and help health professionals who are not child protection specialists to identify the features of physical, sexual and emotional abuse, neglect and fabricated or induced illness. The second, Child Abuse and Neglect, was published in October 2017. This aims to support professionals whose work brings them into contact with children and young people to recognise the signs of abuse and neglect and to know how to respond to these. The guideline covers the recognition of and response to the neglect and abuse, emotional, physical and sexual, of children and young people, and builds on the recommendations that are made in the Child Maltreatment Guideline. Thank you.
Thank you, UK. Slovakia, please, followed by Sweden.
Thank you, Mr. Chair. I am going to speak on behalf of the Czech Republic delegation about the Category 3 implementation of the European Environment and Health Process. The Czech Republic is very proud to step leading towards a truly effective solution of complicated problems connected with the health and environment has been set within the 6th Ministerial Conference on Environment and Health in Ostrava, Czech Republic in June last year. The adoption of the Ostrava Declaration and particularly the development of national portfolios for action represents our immense efforts to address the persistent burden of disease attributed to environmental determinants. Nevertheless, we are only at the beginning and much more effort will be needed to implement the Ostrava Declaration in its full scope. In this regard, we would encourage the WHO to create a template of portfolio and other standardized tools, such as the one for subsequent evaluation. This would not only help the member states in creating their own portfolios, but also set a clear conceptual framework, thus making it easy to compare and evaluate the portfolios. Further, we would very much welcome the establishment of an electronic platform for discussion where delegates could exchange views on specific WHO topics and communicate with the Secretariat. We believe that this platform would not bring additional costs and could be a very useful communication tool to ensure the delegates are well informed and prepared for meetings. Thank you very much for your attention.
Thank you. Slovakia, Sweden, please, followed by Latvia.
Thank you, Chair. Sweden would like to thank the Secretariat for the progress report on the European Child Maltreatment Prevention Action Plan and its achievements to reduce child maltreatment and homicides in the European region. At the same time, we recognize that hard work remains to reach the target of 20% reduction by 2020. Sweden is a pathfinding country in the Global Partnership to End Violence Against Children, which was established in 2016. In February this year, Sweden hosted the first Agenda 2030 for Children End Violence Solutions Summit. The summit brought together governments, the UN, civil society, private sector, academia, and children themselves to share bold solutions for preventing and responding to violence against boys and girls. One of the main sessions during the summit focused on Inspire, a useful evidence-based toolkit composed of 7 strategies to reduce violence against children. As an example of recent activities in Sweden, in line with Inspire, our parliament in June adopted a bill on making the UN Convention on the Rights of the Child Swedish law. We urge member states to accelerate the implementation of the action plan and to end violence against children, as also set out in GPW 13. Thank you.
Thank you, Sweden. Latvia, please.
Thank you, Chairman. Latvia welcomes the progress report highlighting the action being taken in the European region in the area of child maltreatment prevention. We would like to highlight the following points in this regard. Child maltreatment is a greater driver of health and social inequalities through life course. Preventing child maltreatment is a priority for Latvia, and a parliamentary debate held in 2017 highlighted the importance of coordinated intersectoral action to prevent maltreatment and protect children from violence in Latvia. Latvia co-hosted the Nordic-Baltic workshop on child maltreatment prevention in June 2017 with WHO and the Nordic Council of Ministers, which gave an opportunity for the exchange of expertise across the Nordic-Baltic sub-region. Latvia is focusing on the health system's response to child maltreatment both in the area of preventing it from occurring in the first place and responding to it once it occurs. National guidelines of health sector's role in child maltreatment prevention in Latvia with technical assistance of WHO are being developed to achieve this. We thank the Secretariat for advocating for this neglected but important area of public health and for working with Member States protecting the safety of children. Thank you.
As I see no other member states wishing to take the floor, I give the floor to the International Organization for Migration.
Mr. Chair, distinguished delegates, ladies and gentlemen, thank you very much for inviting IOM to intervene at this important WHO Regional Committee meeting. IOM and WHO have a well-established partnership on migration health globally, and Europe is no exception. We follow with great interest and attention the global developments in the health policy discussions, with a particular focus on migrant and mobile populations. In this regard, we're very pleased about the progress that governments have made together to achieve the aim of the Sustainable Development Goals, the 2030 Agenda, to leave no one behind. And this work in health policy sector is now well integrated in global migration discussions, including in the negotiated and agreed Global Compact for Safe, Regular, and Orderly Migration that will be adopted by the member states in Marrakesh, Morocco this December. In line with the SDG target 10.7 of the 2030 Agenda, the Compact builds on member states' commitment to cooperate internationally to facilitate safe, orderly, and regular migration. Most importantly, with the objective of leaving no one behind, the Compact addresses the health needs of migrants, taking into consideration the relevant recommendations of the WHO framework of priorities and guiding principles to promote the health of refugees and migrants, for which the WHO European region and IOM have both been major contributors. I would also like to express our deep appreciation to WHO for leading and inspiring the United Nations common position on ending HIV, tuberculosis, and viral hepatitis through intersectoral action in Europe and Central Asia. We are a proud contributor and advocate of this position paper and are very pleased that during the 73rd UN General Assembly on 27 September in New York, the government of Slovakia with WHO and IOM will host a side event to present this paper. Finally, let me conclude by mentioning an IOM initiative in Europe to improve the health of refugees and migrants and overall migration management, which strengthens health monitoring and health information systems and supports continuity of care for refugees and migrants. This initiative, which is being piloted in 6 EU member states, consists of the rolling out of an electronic personal health record system that will make health records more portable for mobile populations and more easily accessible for healthcare providers. Together with the European Commission, DG Home, DG Santé, and ECHO, IOM has also increased its training and capacity building for health professionals, health mediators, and other stakeholders working with migrants and refugees within the European region in order to better understand and improve how migrants and refugees are best assisted. To conclude, I would like again to thank the WHO for the excellent collaboration and all of the EU member states, in many of which we work so closely with, and with your support, improve migrant health. Thank you.
Thank you, IOM. I give the floor now to the International Association for Hospice and Palliative Care.
Thank you, Chair. IAHPC, a non-state actor in official relations with WHO and accredited by ECOSOC, supports the European Child and Adolescent Health Strategy 2015 to 2020, although we're surprised that the document does not include the right of children and adolescents in the Euro region to access palliative care. IHPC takes a rights-based approach to palliative care, which identifies children and their families needing palliative care as a particularly vulnerable group. Many children born with life-limiting or life-threatening conditions also have disabilities and require palliative care. Children with palliative care needs suffer from a broad range of heterogeneous conditions that require interdisciplinary, holistic interventions tailored to meet the needs of the individual child and their family as part of primary care services. Children's right to palliative care, as well as that of every human being with serious illness, is an integral part of the right to health. It flows from other core principles enshrined in international human rights law, especially the United Nations Convention on the Rights of the Child, the International Covenant on Economic, Social, and Cultural Rights, and the Convention Against Torture. The model children's hospice in the Euro region is found in Minsk, Belarus, and there's another one just up the road in Padova. As children also have the right to access the essential medicines on the WHO model list utilized in pediatric palliative care, governments are obliged to ensure access and availability to easily administrable pediatric formulations of essential medicines for pain and symptom control. These include medicines containing internationally controlled substances, such as morphine, which must be available, accessible, and affordable to pediatric patients in the Euro region. Pediatric palliative care should also be included in all humanitarian healthcare responses and for migrants and refugees. We would like to see this priority included in the strategy. I thank you.
Thank you. Dr. Ostlin, your response or comments, please?
Well, thank you very much. I would like to respond to the comments on the progress report on environment and health and migration and health. And please allow me to start with the progress report on environment and health. And I would like to thank the distinguished delegates who delivered the comment from the Czech Republic. Indeed, we are very grateful for the Czech Republic for organizing such a successful ministerial conference in Ostrava last year. We are very busy with supporting our member states with implementing the components of the Ostrava Declaration, in particular supporting the member states for developing their national portfolios of action. Thank you also for the very constructive proposals, among others, to develop an electronic platform as I understand, this could be an interactive platform. We are going to discuss it in the group. As I mentioned in a previous session, what we have done already is that we have created a special component in the WHO gateway when we have collected more than 350 documents, published those English and Russian, and these documents, tools, etc. are intended to support our member states for implementing the Ostrava Declaration commitments. So thank you very much for the comment. And regarding migration and health progress report, I would like to thank the comment from the International Organization on Migration. Indeed, we have an excellent partnership, and thank you for the collaboration on the many issues that we are doing together. And thank you also very much for updating us on the global developments on the migration governance, so to speak, more particularly on the two compacts, global compacts, one on refugees and the other on safe and regular migration. And I would also like to say that what I think would be very important also in our future work is that we could strengthen our coordinating efforts in this work across the European region, and also with the countries of origin and transit. So in this respect, we have already scaled up our collaboration with the Eastern Mediterranean region and also the African region. And of course, in all these efforts, in capacity building efforts, knowledge producing efforts, we look very much forward to continue our collaboration with IOM. So thank you very much.
Thank you, Dr. Ostlin. Now we can move to the report on the action plan to strengthen the use of evidence, information, and research for policy making in the WHO European region, which is contained in Part H of the document. Delegates wishing to take the floor should raise their name, please. I don't see any. I just announced that we have two written statements from Thalassemia International Federation and European Public Health Association. I don't know if Dr. Stein wishes to say something. Yes, please.
Thank you very much, President. The fact that member states aren't speaking, well, I think that's a sign that they're happy with the progress report, but I would like to thank the member states for the various and rich comments that they've made throughout the regional committee. It's crystal clear to us now that health information, data and monitoring for member states play a key role, and they play an increasingly bigger role. And we also know that they value the European Information Initiative, so no meeting where monitoring is not mentioned cannot take place. We're very thankful for the fact that the member states appreciate our work, and we appreciate their work that is carried out at a country level. We have a lot of challenges ahead. Yes, that's true, and we need to expand our gateway even further. We have we're going to launch and implement the Joint Monitoring Framework, the JMF, and we are going to kick off the next round when we're talking about the health indicators for Health 2020. I'd like to thank you once again for the fantastic support that we've experienced throughout the last year since the last regional committee. It's a privilege to work with you, and I hope that over the next 12 months we will have very fruitful work and we will make great steps which we'll be able to report once again at the next regional committee. Thank you very much, and also thanks to you, President.
They inform me that not all the questions have been answered, so I give the floor to Dr. Mikkelsen to give the rest of the answers.
Thank you so much, Mr. President. I'm very happy to provide some comments. And thank you very much for the interventions from the member states. And I'm very pleased to see that all of us see childhood and adolescence as the critical stages in the life course, and that many of the comments also were towards the fact that actually 55 million children in this region is affected by child maltreatment. So coming back to the comments, thank you again for the contributions, both the guidelines from UK, also for Sweden being the pathfinder, and also for Sweden to reflect on the fact that we have a global toolkit called Inspire, and we will be sure to focus on that in the coming period. Also, the Nordic-Baltic meeting was extremely important for us. So my last comment goes back to palliative care. And we have considered palliative care in the health systems to respond to NCDs. And we will probably have a good opportunity as well now when we will focus on childhood cancer. And the last comment on palliative care is also that it's part of the childhood and adolescent strategy, and we will be sure to report back on this in due time. The absolutely last comment is please also visit our data gateway, where you will see country profiles for childhood and adolescent health. Thank you.
Thank you. Finally, we will consider the progress report on accountability and compliance, which can be found in document EU/RC68/8J. Delegates wishing to take the floor should raise their nameplates, please. I see none. Germany, okay.
I was just discussing with the Greek delegation something else, so sorry. Yeah, thanks a lot for the report. Compliance and accountability is always an issue that we devote quite a lot of energy in, and we deem a high priority in Geneva as well as in Copenhagen. So certainly we have the pleasure to take the floor on this important issue. We thank the Secretariat for the report. We read it carefully, especially the section on internal accountability and audits. The report says that There are some key systematic issues that were identified in various areas, and for us it would be interesting to learn a little bit more about it. What are the challenges, and how can the RC as the oversight body provide its guidance on how to overcome these challenges? So maybe a little bit more substance on this would be interesting, maybe not now, but at least in the next report. Another key issue which we've raised in Geneva, and I think it's also relevant for us in the Euro region, is accountability, compliance, risk management is all funded. It's category 6. It's all funded through, to a large extent, I guess, assessed contributions. And normally we face the problem that not enough resources are being allocated to this category 6. So we would be interested in learning more about the situation in our region. Is there enough money foreseen for accountability, risk management, and compliance? That would be at least the will of the German delegation. And the final thing, I'd like to come back to the issue of HR, which is, from our point of view, the core valid of our organization. It's WHO's committed staff, enthusiastic staff. I think it's our role as member states to make sure that the working environment is as good as it can be. One key issue, well, so there needs to be an enabling atmosphere, climate. This is why we fully support the Respectful Workplace initiative. We'd like to learn a little bit more about it. In Geneva, there's been quite a lot of discussion about harassment, not in our organization, but in a very close partner organization. So we'd like to know a little bit more on how the regional office prevents and deals with harassment cases. Maybe there are some, if none, how we're doing, if there's a prevention policy, because I think that's linked to the Geneva debate. Thanks a lot.
Thank you, Germany. I see no more speakers, but I'm sure that RD wants to say a few words. No? No. Okay. Okay, Susan Basiri is going to give some answers and comments.
Distinguished delegates, and thank you very much for the questions. Apologies, I was sitting. Thank you very much for the comments, and definitely for the next report we will put more elaboration on the areas. Absolutely, the question on resources is a challenge. In the European Regional Office, we have been able to strike a balance and expand the team. In the course of last biennium, we had actually expanded our structure for compliance team, but still it's a work in progress, and we need to build capacity at country level. So that is our focus for the current region, for the current biennium. With regards to Respectful Workplace initiative in the European region, we have been pioneering actually some work in terms of this initiative. The regional chapter for this global initiative in Euro has been quite active. We have planned for some activities during 2017, and we continue for 2018. It's a work in progress. Next month we have a meeting of administration and staff associations, and we will discuss the way forward. With regards to harassment policy, the update of the harassment policy is under discussion. We have the version of harassment policy of 2010. We are looking at the next version, and still not yet finalized. It is to be finalized. And certain new intensified communication and information sharing with regards to harassment, publicizing further, communicating further the mechanisms we have. We have a well-established whistleblower policy. We have a well-established ethics, codes of conduct office. So we are looking at further communication for access for all offices, all staff in all the countries, ongoing work, and we will provide you with more next report. Thank you. Thank you, Chair.
Thank you very much. Dear delegates, dear friends, this brings us to the end of this agenda item.